Right, 11 minutes past the top of the hour. Thank you for sticking around. This is Morning Cafe News to Stanley Nyarungita. It's a Monday, definitely. We're going to be discussing matters health. And this particular morning, discussing matters cervical health and the whole of it. January is Cervical Cancer Awareness Month. But this morning, as much as well, we'll be largely discussing about matters cervical cancer, but then we'll be touching largely on the health of the cervix itself and really have amazing, guests this morning and the sharpest of minds to discuss this particular bit. Millicent Kagonga, cervical cancer survivor, as well as the founder of Symbol of Hope Warriors. Karibu sana.
Asante.
Seeing the whole, even in your t-shirt, the survivor.
Yes.
I love how you played around with those words. Yes, and later on we'll be having, she'll be joining us later, Lillian Mutua, Health Promotion Coordinator in Nairobi County. She's not a new guest on this panel to discuss the whole promotion, the whole cervical health promotion largely, even in devolved units, really decentralizing this particular, when it comes to the health promotion of it really. Let's take a look at some numbers here to bring context to this conversation. So according to the World Health Organization, cervical cancer is the fourth most common cancer in women. However, it is cervical cancer now really itself is the second most common in women. And according to the HPV, human papilloma virus info center, Kenya has a population of 16.8 million women aged 15 years and older who are at risk of developing cervical cancer, and every year 5,236 are diagnosed, while 3,211 die. We'll be getting to understand, as much as these are just figures, but then these are human cases, so how really important are they? But first of all, let's twende back in the days, back in the years, tukumbushe, because I'm pretty sure in story yenye umeshare, before uanzishe, this particular organization, hata before uanzishe organization, jani yako ilianzia wapi? Tuanze tu hapo.
For me, I was a healthy young lady, a healthy young lady, and who was very afraid to talk about anything below the belt, and I was very shy to talk about anything below the belt. I was shy. So at the age of 14, I got my firstborn. I have another story, but that is a story for another day. So I got my firstborn at the age of 14, and at the age of 20, I got my thirdborn. Why am I sharing about this? It's because the research they have done the research, and it shows that for getting sexual active early, it gives you the risk of having cervical cancer. So I was sexual at my young age, and I was sexually active at my younger age, and at the age of 20, I was already having 3 children. And the same year, I lost my secondborn, and I started having this abnormal discharge because I was married. And since we never understood what is going through, about what is the reason behind my abnormal discharge, so I lost my marriage. And I kept quiet for almost 5 years. And I decided to look for help for other people, but indirect. I went to them and telling them, asked them, I have a friend who is having this abnormal discharge, and even she has lost the marriage because of abnormal discharge, until I didn't get the right answers. So some of them told me, tell your friend she's eating a lot of cabbages and warus, so she needs to change the diet. Or the others told me, your friend needs to go for prayers, it's a cane from God, that is a witchcraft, it's a bad omen. So there was a lot of information whereby it was not the right information that I needed. But I wish I knew at the age of 20, I could have just gone to the hospital and did my pap smear or the screening, and I could have saved a lot of money, and also even my uterus at the same time. So after 5 years, that was in 2015, I saw a lady talking about signs and symptoms of cervical cancer, and it was the same thing that I was going through. So I decided to take a step to go to the hospital. I was 25 years, and by then, the guideline from WHO was you need women within 35 years and above for them to do the screening on the pap smear. So I went to the first facility. I was told, no, you are still young to have cervical cancer. We can't do screening on pap smear now. You need to go and do the STDI test. I did. They told me it's infection. I got the drugs, but it never helped. I went to another facility. I insisted, and I told them, if you are not going to do the screening, I'm not going to get out of this hospital. And that's when I got the message. It was like a death sentence, because I was told, I'm sorry, Millicent, you have cervical cancer, advanced stage. I fainted.
Apo kohosi.
Yes, korogosho. So I fainted, and I came back, and they were just sitting there.
Were you alone at that time?
Yes, I was alone. And they told me, you just need to go and do some more tests for you to know what kind of treatment you need to do. And we are very, very, very sorry. They really apologize. Yeah.
So, okay, now for the 5 years, to hizo miaka tano, from 20 hadi 25, what kind of treatment, na tutakuwa tunaguzia ina Mutua later on, but then because at this time, haujui kama kuna cervical cancer. So what was your treatment options?
I use traditional treatment, because I was asking someone else, and someone was giving me the information to tell my friend, whereby it was me myself. So I tried to use the traditional medicine. I prayed a lot, but the situation was still there. And that is what is happening, because the research is saying that in Kenya, we are losing more than 8 women to cervical cancer daily. And for me, I can say like more than 10 or 20, because for the statistics to know that this lady has cervical cancer, the lady must do the biopsy, whereby the biopsy test is very expensive. It's around 40 to 45,000. It's very expensive, and not all women can afford to do that test alone. So most women, they are dying at the period of the diagnosis, because they can't get the money. You can imagine me coming to you with this economy, like right now, asking you for almost 50,000 for the diagnosis, not even for the treatment. So that is where we are losing it, and I'm glad I passed that stage.
And speaking of stages, Ali umetuambia, umeenda hosi, korogosho, ukaambiwa advanced stage.
Yes.
Doki alikueleza inamaanisha nini hiyo?
Okay, when you go for the screening, there is different charts. There is the normal cervix, and the first stage cervix, the precancerous cervix, and then there is the advanced cervix on the chart. So they show me this is how your cervix looks like, and that was stage 4 cervical cancer. Yeah.
So as a survivor, okay. After that, tuka faint nini, your journey ikaanza hapo, ukaform, the whole symbol of hope, warriors. Ilikuwaje hata, even the idea ya, wacha ni form community-based organization, ndio nisaidia hata wengine. Idea ilitoka wapi?
So nimeishi Kariobangi sana. I've lived Kariobangi until right now. I still live in Kariobangi. And when I was diagnosed, I was in Kariobangi. So I went through a lot of stigma, because now you have cervical cancer. Most people are waiting for the pain or also for the blood for them to go to the hospital. But with cancer, it's a different story. If you wait for the blood or the pain, the cancer is already on advanced stage. So I started having this pain, the pelvic pain, the back pain, and also having now discharge, but it's a very smelly discharge. And when I was going for my treatment, it was hectic because remember, my family doesn't have the information about cancer. Now, most of them, they thought like if you are having cancer, it's like a witchcraft and you don't need to be with them. So most of them, they tried as much to stay away from me. And at the plot where I used to live, it was very stigmatizing because even some of them were not allowing me to share the toilet with them. So it was hectic.
Because of the whole discharge?
Yes, the discharge. And when you go to the toilet, it's very smelly, of course, and it's not, they feel like they are not safe. And I don't blame them right now. Those days I used to blame them, but now I don't blame them because by then they didn't have the information and they needed someone like me to give them the information. So I did my treatment at Kenyatta Hospital. And by then I used to sleep at the corridors and other patients used to give me hope. They encouraged me. Some of them brought me food. Some of them, we shared together, we cried together. And I was among the people who were sleeping at the corridors there in 2017. And most of them died, not because they had cancer. They died because of stigma. Some of them died because of the pneumonia, because of a lot of baridi there. And I'm glad I'm here to tell my story. So from there, I told myself, if I'm going to get another chance, I'm not just going to keep quiet. I'm going to speak out my story and also to share my journey. And my biggest aim is going to stop the stigma.
What was the word cervical, or rather those two words, cervical cancer, were they common back in 2015 around Kariobangi? Ukitembea, kwa road nini, ungeisikia watu wakiona conversation kama hizo?
No. Even those days, you see, like me, I kept quiet and I was having this abnormal discharge. I didn't have sanitary towels, so I was using my t-shirts or the rags to take care of the discharge. And sometimes when I'm walking, utapata a lady akona stain nyuma, whereby your stain is not a period, it's a stain. So whereby this lady is not doing well. Hata kama unamwona akitembea, the lady is not doing well. So I told myself there is a lot of Millicent outside there when you wamenyamaza and they need to get the information. That's why I formed the organization Symbol of Hope Warriors.
So, okay, which year was it formed?
In 2017, after my treatment.
In 2017, so going back now to the society, watu walianza since then hadi sahi, 2017 hadi 2024 now, kumekuwa na progress yote. Sahi hata ukiona conversation kama hiyo mbele ya watu mkiwa kwa soko pale, having these conversations, watu hawataanza kuangalia huyu ni nini anaongea.
Okay, what happened, nilihama from where I was stigmatized, nikaenda another place whereby it's still in Kariobangi. But at that place, bado nikaanza kuona the stigma. So what I did, I decided to come out of the house and I said, I told them, I have cervical cancer, I can't bend, and I'm going through the situation, but I thank God for my children, whereby my son was my caregiver. So I thank God for my children because they are the ones who are taking care of me. And on the other side, we had a lady who was having cancer and she was not speaking. Lakini alikuwa na hasira nyingi sana. So the lady akaniambia, umesema nini? Even me, I have a tumor. So can we work together? We started working together. We started meeting at my house. We cried together. We share our journey. Most of us, our husband decided to take off. So everyone was saying, like, my husband decided, my husband said this, my family said this. So we cried together. And that's where we told ourselves, together, we have strength, and together we can have hope. So you are precious, you are beautiful, and you are also loved.
So in 2017, how many were you?
We started like 4 of us,
4.
And then 10. Right now we are more than 400.
400?
Yes, not only cervical cancer, but cancers. Yeah.
Is it only around Kariobangi, or you've gone to other?
Lando.
Oh,
yes.
Okay.
Yeah.
So Sahi, because I've been. You'll talk to a number of girls, young girls, who unamwangalia unaona, this was me back in when I was like 20. What do you hear from them? Because when back in 2010, at that time, life was different. Hakukuwa na access to communication nini. At that time, I think Facebook ndio ilikuwa imeanza, but haikuwa as the whole idea ya communicate na kushare information through the digital platforms haikuwa as much. Life was different in 2010 as it is now in 2024.
Right.
Sahi ukiongea na these young girls, what do you hear from them?
Okay, for me, I decided to start with my children first, and what I forgot to say is that my daughter was the first one to get HPV vaccine in Kenya. Yes, and me and my daughter, we are in that cover of WHO because I'm in the front line to prevent cervical cancer. Because if cervical cancer is prevented, there's no need of us going through cancer. So it's better we start with the prevention. So I do go to schools and talk to girls. Mostly those girls when they are pregnant and they are giving up, and most of them or some of them they are sexually active and they don't have someone to talk to them about that. So I talk to them. And most of them, the response is, I can say it's making a big impact because some of them, they are getting more knowledge and they know how to take care of themselves. And it's good for us. What I can only say, it's good for us to talk to girls at the right way. Because I saw someone talking about sex education, and she was telling the girls, "Iyo kitu inakaa mbaya." So you see, the way we are passing the information is very important. Yes.
We'll get to the whole how sex education should be done, even in informal settlements, because there's a way unaweza fanya the whole sex education kwa shule in a school setup that brings about people from different backgrounds. Na kuna venye unaweza ifanya kwa setup ya informal settlements. Ukienda pale Stlando kuna lugha yenye unawaambia. But then before that, umeongelea HPV vaccine, and before we take a short break, this is a conversation that I feel we should really largely have later on. We'll be having this even with Mutua largely. I mean, even congratulations to the whole effort that you made your daughter. I mean, that's history, by the way.
Yes.
I believe that was in 2019, right?
Yes, in 2019.
When Kenya had the whole HPV vaccine.
Yes.
Sahi 2019, Adi Sahi 2024. Back to the society. Ukiongea na wanaelewa. I mean, ukiongea na a young girl. I mean, she's amemaliza let's say KCSE juzi, and sahi anaona niko free, and she's just 18 years old, but unamwambia unajua HPV vaccine ni nini? Do they know?
Some of them knows, some of them doesn't. And like I said, it depends the way you are passing the information. But it's very important. Some of them knows about HPV, but what comes kama mimi, I have like a parent has already told the girl HPV is something else. So it depends the way you are passing the information. Some of them wanakupatia the right answer, some of them wanakuambia hapana, mamangu alisema hiyo kitu si mzuri.
So how do you is it, first of all, is it in your ni wewe ndio unafaa kumconvince, okay fine, even ndio uliambiwa HPV vaccine mbaya, so wewe ndio unafaa umwambie, by the way, okay, hiyo information uliambiwa si hiyo, this is a correct, is that in your line of duty?
Yes, I do it voluntary, and that's why I normally say our government needs to work with survivors, because our story really matters and our story can make a change. Because we went with the Kariobangi Health Center, we went with them for in one of the schools in Kariobangi, and all the kids were refusing to do the vaccine. But when I came there and asked them some question and told them why they need to get the vaccine, every girl remembered their birthday date, and that was a big challenge. So we need to work together hand in hand with survivors, and also to tell them it's all about the information, the right information,
right.
And that's one we will get far. We'll be able to eliminate cervical cancer.
Okay, and speaking of the right information, we'll be giving you this, largely later on. Kevo, I think you can, take a short break right about it's 8:30, half past the top of the hour. Later on, tukirudi after this particular short break, Lilian Mutua, Health Promotion Coordinator, right here in County 047, will be joining us, to idea, for this particular conversation, to break it down, to elewe. I mean, earlier on I was telling you about these particular numbers. Keep them in, at the back of your mind, because we'll be diving into them later on. Kuelewa, according to the HPV Info Center, says Kenya has a population of about 6.8 8 million women aged 15 and older who are at risk of developing cervical cancer. So every year, 5,236 are diagnosed, while 3,211 die. How severe is this? Should we be worried? Stick around for this after this break. Right, karibu tena. This is Morning Cafe discussing the cervical health awareness. As I was telling you earlier, January is Cervical Cancer Awareness Month, and we'll be discussing this. We have been discussing this with Millicent Kagonga, who is a cervical cancer survivor, as well as the founder of Symbol of Hope Warriors. And she was just telling us her journey back in 2010 all the way until now, how she has really, and trying to change the whole perception around hizo sides za Islando. So if you're probably there and you unaangalia isura nimeona mahali, it is her, telling these particular stories. And not a new face to this panel, Lilian Mutua, Health Promotion Coordinator, Nairobi. Karibu sana.
Asante.
Traffic leo
sijui leo watu Nairobi wanaenda wapi?
Ama
fuel imeenda chini.
Form 1, the whole Form 1.
Ama fuel imeenda chini.
Oh yes. Now from the whole of it, before we were talking about the HPV, but then now from what you do as a health promoter, I'm pretty sure you have interacted with patients, cervical cancer, and largely, all that. We're talking about the whole screening, pap smear, akiongelelea how even in schools, young girls don't really understand HPV. What's your experience in this?
What I'll tell Kenyans is that most of our ladies or women are not going for screening. And screening is one of the necessities for us to do, especially ladies who are sexually active, because unlike other infections,
you get the HPV infection today, you might live to 10 to 30 years without knowing that you got the infection. So it's not an acute infection, it's a progressive infection. So once you get the HPV vaccine, virus, you stay a while with it before you see the first maybe signs. And mostly even the first cardinal signs, people really confuse because some people will think that they're having irregular menstruation, maybe spotting, and they do not take the first step to go and check what it is. And if they do not go to a very good specialist, they might also be misdiagnosed. We've had some of the patients saying that when they started having the frequent spotting in between their menstrual cycles, they were treated for irregular menstruation. So that is a misdiagnosis. So we really request all the women who are sexually active, regardless of age, from 24 and above, to go for screening at the nearest health facility. The screening is also offered in the public health facilities. So you just need to go and request for that to be done to you, and then you can be told whether your cervix is healthy or not. The biggest worry is also that unlike other body parts where you are able to, maybe by yourself, for example, if you are developing the breast cancer, you're able to palpate and maybe find a lump or see changes in the skin around your breast. But for the cervical cancer, the cervix is hidden. So there's no way you or another person can see it with naked eyes. So you really need to go for that screening. We also want people to demystify that cervical cancer is not a sexual transmitted infection like gonorrhea and syphilis and others, but is also transmitted sexually. So if your male partner has had interaction with someone who is having the HPV virus and gets into sexual contact with another lady, that is how the transmission goes.
Right.
The man is a transmitter, but will not get the HPV because he does not have a cervix.
Right. Hold on that thought, because I want to get into a whole conversation later on how much impact the man really has to do with this conversation. But before that, the conversation on age, you're talking about first of all, I mean, you said age not a huge factor, but then as of 24, right?
Yes, for the screening.
For the screening. Millicent was telling us here that before she was even, I think she was about 25, but then she was told that at 35, it can't be done at 35. So how do these policies range when it comes to age? Will you advise young girls even below the age of 24 to go for this?
The policy states a bit of an advanced stage, but depending on the history of a client, we know that some of the girls get sexually active too early. So it depends on how that interaction with the service provider is, because even before you go for the screening, there is counseling and guidance given. So if a lady is younger than 24 and she's been sexually active, we will know whether she requires to have the HPV screening or not. And for the HPV screening, it does not come as screening alone. It's a package. We need to educate you, we need to counsel you, we need to guide you, we need to know your sexual lifestyle and tell you the pros and the cons. That way then we say we are doing the preventive promotive health. So it's not all about curative. For someone who is screened and found that the cervix doesn't show any abnormalities, then we need to guide you on how to prevent yourself from getting cervical cancer. And one of these is making sure that you do not have multiple sexual partners, because you don't know who can infect you. Just like the way we talk about HIV AIDS, it is the same. You must take care of your sexual lifestyle. Your partner must be faithful. You must be faithful. You must make sure that if you're going to have sexual activity, it should be protected. I know there are many vices, maybe through religion and culture, but we are looking at the safety of this lady and also of the partner. So there's a lot of education. It's a package that we come with. Once we find that you have the earliest signs of the cervical cancer, we are able to give you some treatment using a management that is called cryotherapy. This is very cool air that is driven onto your cervix so that it freezes the cells so that they don't multiply. So that is the first curative measurement that we have for those who are showing the telltale signs of cervical cancer. But if it is advanced, then you are requested to go for further diagnostic tests where they will take some of the sample from the cervix and go and see how much it has advanced. For those who, when we look at the cervix, looks that it has an advanced stage, you can go through radiotherapy and chemotherapy. So there are different stages. So we have stage 1, 2, 3, and 4. We have stage 1, stage 2A, 2B, stage 3, 3A, 3B, and stage 4. So at stage 4, it is advanced and it has spread to other organs that are adjacent.
And well, earlier on, Millicent was telling us that having the conversation of HPV even in the society, asking someone, there's a lot of misinformation when it comes to even in most informal settlements and even among marginalized communities. Just a follow-up before I get to you, Millicent. From where you sit, and just a correction on the whole title, it is Head of Health Promotion in Nairobi. In your docket, how common is HPV among women in our society?
We will say that more than at least 9 women will die of cervical cancer in a day. And these are the ones who are already coming for treatment, coming seeking for medication, coming for screening. And there are those who maybe never get to the hospitals and just ill at home. What we'd really want to appreciate the Ministry of Health together with the county governments is that the HPV vaccine, that is the only preventive measure for you not to get the cervical cancer, is now readily available. We know we have had many misconceptions and misinformation going within the communities, saying that the HPV vaccine is a contraception. And we know this is a lot of misinformation, especially through the social media. We cannot give our young girls contraception at that age. First of all, it is illegal, it is unethical. So this is not what it is. And I think most of the Kenyans do not know that before HPV vaccine was introduced into the routine vaccination through the Kenya Expanded Program of Immunization, Ministry of Health, HPV vaccine was already there in the country. And it was already being given in the private facilities like the Aga Khans, the Nairobi Hospital, Karen, the big hospitals where people pay. And this vaccine, people were paying for even as much as 7,000 to get one shot. Still, when you go to those private hospitals, both girls and boys are given from the age of 9. But because this is a vaccine that has been introduced by the Ministry of Health as a routine vaccine, it is being given for free. And we are only targeting the girls because it is a prevention measure for HPV infection. For the girls who will later suffer maybe the cervical cancer. So it is not a relatively very new vaccine in the country, but it is newly introduced into our routine immunization program. Also, we have some religious fractions that do not accept the vaccine. We also have some cultures where they say that they will not accept their young girls to be given anything. And even some of the people do not want us to discuss the issue of cervical cancer and HPV vaccine with the girls because they think we are talking about sex. This is sexual education. We are not indulging with the girls to inform them about sex, but how to make smart choices, how to take care of their sexual health. We even help the girls to know how to to maybe keep away from sexual activity by waiting until appropriate age, and also give them information how to empower them to say a no that is a real no if someone is advancing them to sexual activity way early in life. So we also are encouraged that right now Ministry of Education has come on board to help us demystify issues of HPV vaccine as one of the routine immunization, just like COVID and other health-related issues.
Right.
So we are working closely with the education ministry and departments from the national to the county to the sub-county up to the facility level.
Right.
And we are also bringing on board religious leaders. We are working very closely with the Interreligious Council of Kenya.
Okay.
We are also working with other religious leaders to understand the whole concept around cervical cancer and the HPV vaccine.
Right. Kagunga, in your view and over the years, what do you think should men be in this conversation, first of all, and not only even the cervical cancer, but then generally the health of the cervix as it is? Should men be in this conversation, and what will be the impact if they're going to be in this conversation?
For me, it's good men to be in their conversation, because we all together we will be a good team to fight cervical cancer. Because like for me, my husband didn't know what I'm going through. He decided to work out, and also I have a son, and I want my son to be there for his wife. So it's very important for men to be in the conversation, and also when the lady is going through the cancer journey. When the lady is going through the treatment, it's very important. That's why when you are going for family planning, you are advised to go with your spouse, so that you will be able to know what are the risks and what is the benefit of that family planning. So it's very good for us to put the men on board, so that we'll be able to eliminate cervical cancer as a team, not as an individual.
Kwa ground, are men around taking up this conversation?
Some of the men, they feel like you can't talk about cervical cancer when they are there, because some of them, they are afraid, and some of them, they are thinking like it's none of our business, whereby it's all of us. It's all our business. Yes.
Really. And
maybe if I can interject.
And even as you come, on board on this, because earlier you're saying HPV. The man will sexually transmit it to the lady.
Yes.
So, is there screening now for the men when it comes to HPV? Even for the HPV vaccine, should it also be given to the men? Is it given to the men? Demystify this for us.
We will say that the screening is not done for the men. Because we know that the men, you will not, like I said, when we are screening for cervical cancer, you screen at the cervix. So for the men, it is impossible. What we do is normally to bring them on board, especially if a lady is requesting to have the cervical screening done, we will ask if the partner can come on board, so that we educate them together, we counsel them together, we tell them about their sexual reproductive health. And then when the lady is getting the results, we normally want the partner to be there so that they can support them. Whether it's negative or positive, even if it is negative, he needs to support the lady so that they can journey together through the prevention promotion journey.
So before you continue, so at the end of the day, so how will the man know that they have HPV?
The man will not know.
Should they know?
They will not know.
Okay.
They will not know.
It's so basically
just like
undetected.
Yes, it's undetected. Because when we look at the male reproductive organs, yes, it has the very tough skin. So there's no way it can penetrate easily. But for the woman, once she gets the HPV virus, it is deposited at the cervix, and it starts its journey of now making that cervix abnormal by infecting it. And it takes a period of years. So if this is a man who is having another partner who already has the HPV virus and continuously comes back to this other partner, it means every other time he's depositing more. I was saying I wanted to interject by saying the men should come into this conversation.
Okay.
First of all, to understand why there is a problem of having maybe multiple sexual partners and you do not know their states, whether they have the HPV virus or not. Secondly, for them to understand that they are guardians for their women, that is their partners, be it a wife, be it also a relative. If it is your mother, your sister, your daughter, you should know that information so that you pass it around. I'm very sure that if you have a daughter and as a father you give her information, she trusts you as a parent, she will take it positively. And you will be giving her information right at the household as a parent. So for the cervical cancer prevention, we want this, we are asking anybody who participates in this topic, just like Millicent has said, let it be a household conversation. Let it not be outside there, but a household. And I normally encourage men when I'm talking about this topic, even the ones who are right now in the studio, when it is your girlfriend's birthday, when it is your mother's birthday, when it is your sister's birthday, the best present you could do is to remind them to have the cervical cancer screening. For any girl who turns 10, it is the responsibility, you as the father, not the mother, you as the father, to take that girl to get the HPV vaccine. Why? When we are getting our girls married off, you normally hold your girl's hand. So journey with your girl through the vaccine.
It should be the same as...
It should be the same.
And even as you continue, and even in Nairobi, because I'd really want to get into conversation here, I mean, both of you from Nairobi, but then could decentralize this conversation, you know, as each county to really, you know, have this conversation on their own. In Nairobi, you know, in itself, so far, since, you know, 2019, how many girls have been vaccinated?
We have more than 300,000 getting the vaccine. Some of them, we know they are not residents of Nairobi, but like during the school holidays, we still do community outreaches to get them vaccinated in the churches. And we know even in the churches in Nairobi, people come from as far as Juja, Ruiru, Kajiado, Machakos, Ngong. So we are vaccinating our girls.
So it's a frequent...
It's a frequent exercise. And we are also, all facilities in Nairobi have mapped the schools that are nearest to them, and they carry out these conversations. So after every 6 months, they visit the school. They look at the girls who are 10 years old, who have already attained 10 years, and they give them the vaccine.
Right.
If the girls also are attaining 10 years before the facility in nurses go to the school and the school health nurses, you even find the school teachers prompting the facilities that we already have this number of girls who are 10, and we also have those who need their second doses.
Right.
We've had a big challenge where some of the girls have gotten the first doses and never got the second doses. We know there's that transition of school. Maybe a girl got a vaccine when she was 13 or 14, finished her standard 8 and went to a different school, maybe in a boarding in a different county. We are trying to see from the Ministry of Health how all this can be digitalized so that we can see where these girls are and they can also get prompting messages. So it's a collective call. And for me, I normally say the journey of cervical cancer and the burden of cervical cancer at the end of the day lies with the family. If you are a lady who is married and you get cervical cancer, or you are a mature lady and you get cervical cancer, it will affect your partner or your spouse. It will affect your immediate family, that is the in-laws and the family where you're born with. It will affect your colleagues maybe at your workplace.
Right.
It will affect the people in your religious congregation. It will affect your neighbors and your neighborhood.
It has a huge burden around people. And that's where I would really want Millicent to pick up from, because as a CBO, you really work with, you know, families from these, you know, informal settlements. What kind of burden, and mostly the financial burden, that really lies, you know, with when it comes to cervical cancer for the patient itself? I mean, you're telling us at that time your family, first of all, doesn't really know what is going on, and even the whole financial burden that comes with it. Talk to us about that. Okay,
about the financial burden, when I was doing my treatment, I'm glad I was one of the luckiest. By then, NHIF was paying all of most of the treatment. I only needed to pay for the blood works. So I was among the luckiest people, not like right now is something else. So I did my treatment well, but by then I needed a support. You see, when you are giving a cervical cancer patient support, it's like a walking stick you are giving them to go through the journey. And right now, the challenge that we are having in the community is financial burden, and also the support from the family members and the stigma. Yes, we are still working on the stigma, and it's doing well. And if I may add on that, we have screenings everywhere, and the screening is free. So if you are a lady, you're out there, you just need to go to the nearest facility and do the screening for free. So we have the right information on the ground, like right now.
All right. And mostly, the whole idea that cancer is for the rich. I mean, this inakuwaga imekuwa for long. Ukiambia mtu kuna cancer, like, hizi ni ugonjwa ya wadosi. Is it still there in the communities that you interact with?
For me, nilifikiria hivyo. The moment niliambiwa niko na cancer, I started asking myself, I'm not rich, why did I get cervical cancer? But now the right information to tell those who are still thinking about cancer ni ugonjwa wa wadosi. It's like wadosi walijulikana wako na cancer because walienda hospitali. Na wenye hawana pesa walikufa wakijua ni kurogwa. So unaona, that is the difference. So huyu alidai akijua ule mtu wetu watu wao walijua huyu alirogwa, that's why alikufa. But mdosi alipata opportunity ya kwenda hospitali. So it's high time for us to be responsible. All of us must have the insurance. Saizi imebadilishwa from NHIF to something else. So so kila mtu anafaa kuwa na insurance, na kila mtu anafaa kuwa responsible, kwa sababu ukienda hospitali ndio utajua. All of us, we are fighting, whether when ni mdosi ama si mdosi, it's still a burden. So hakuna shortcut.
Right.
Juu hakuna mtu mwenye ako tu na pesa hapo inangoja msee apate cancer.
Right. And Mutu, even as you come in this, the whole financial, I'd also love you to talk about the whole workforce, kind of burden. Will it be to blame? Because I mean, we're taking a look at, so last year, according to HPV Info Center, about 5,236 are diagnosed with cervical cancer, while 3,211 die. That's, annually. Can we say, workforce, the fact that inaweza kuwa imepungua ama haitoshi, can it be blamed?
It's not about the workforce, it is about late diagnosis.
Okay.
People are coming too late when already the signs are there. Like someone is having false smell, some false smelling discharge, they are having vaginal bleeding. That is when they are coming, which means it's already either at late stage 3 or stage 4. So the earlier they come, the better the management. I say that the first management during stage 1, you can get the cryotherapy. It's locally available in the health facilities. If they find maybe you're already in stage 1 or 2, they will send you for further diagnosis to see whether you will be able to get the radio and chemotherapy. But if it is too advanced at stage 4, now that is when even it really drains the finances. Because number 1, there is the emotional burden, where like Millicent was saying, you ask why me? Why now?
Yeah.
What did I do? So your emotion perceptions also are interfered with. Then there is the psychological aspect of it, where a lot of issues are running through your mind, especially for the lady, because she's thinking, I've been told I have cancer. At this stage, will it kill me? Who do I leave my family with? Who will take care of my children? What am I supposed to do now? Some go into denial and say that it cannot be cancer, it could be something else. So instead of continue with management, they go and look for other things that can be done to them. Maybe spiritual prayers, maybe others go to the to visit the traditionalists, the herbalists.
And interesting, because I was actually now coming to that particular question, because earlier on, Millicent was telling us, she went through all that, before she actually, 5 years later, before she was, diagnosed with it, around 2015. Akajaribu is traditional. And now I think my next question was, what are some of those treatment options? As much as umeziguzia hapa na pale, but then really break it down for us, even for someone, another Millicent, they're watching us, they're like, nashuku niko nayo nini, ama I'm trying to get into this treatment. What are some of those treatment options that they have?
So number one is first the screening, as part of just to know whether you have the cancer or not, the cervical cancer or not. Then number two is counseling. Whether we find that you don't have the cervical cancer or the suspected cervical cancer, that is at the very early stages, there's counseling. Whether we find it at advanced, we still do counseling. So we have to counsel the person to know where they are at and what needs to be done. Then there is guidance on what type of medication or what type of curative management you need. And the curative will come in different forms. We've said the very early telltale signs of cervical cancer, you'll get the cryotherapy. Then you can get the radiology treatment, and you can also get the chemotherapy. So you don't get all those treatments during all stages. It depends where is your suspected cancer stage in. So once they stage, they can now tell you this is the appropriate management. And through the appropriate management that is for the stage that you are in, it's a discussion. You are given options. You are told, if we need to start you on radiology, you need to do these blood works, you need to do maybe your liver function tests, we need to know how your kidneys are working before we start any medication. Then when it comes to the chemotherapy, there are different forms, and you are being told this one will be given at these intervals for this duration. So it's more of discussions on and off, with appointments in between, with lab works being done, with a lot of blood works also being done. We also support the patient psychologically. So there's psychological counseling. We also can affiliate you to a social worker if that is needed. And then there is continuous education through the process. So it's not a one-stop shop, as in this is your treatment and we leave it at there. It is progressive. And if you ask someone like Millicent, who is already a survivor, she still attends clinic. On and off, she gets medication. We need to see how her body is reacting, because we found people who, once they've been told that they have survived the cervical cancer, they go off appointments and everything, and then maybe we do not know what is happening to their body. So some of them maybe slowly might also progress. If they not also follow the instructions given, like living a healthy sexual lifestyle, it could recur.
How often does that happen though? I mean, having a lady surviving cervical cancer?
If we get it at the earliest stages, it is possible.
So
before stage 2.
In numbers,
we cannot really say, but we cannot give that, because it differs from one person to another.
Right.
Because we might even get you at stage 1, but you have other issues health-wise. For example, you could be having a suppressed immunity. You could be also living with other conditions like diabetes, where we know if you have issues like diabetes, your body is prone to get other infections, and to get treatment successfully is not very easy because of the blood sugars that are within your blood circulation. So it depends from one individual to another.
Right.
But we can say that once we get it before it advances to stage 2, and especially 2B, there's a lot that can be done. We've also found those who have the cervical cancer and maybe are of, they are through with their maybe reproductive age, And we can also have what we call the hysterectomy, where the uterus and the cervix can be removed.
Right.
Yes,
Millicent,
surgically.
Right. Millicent, I was taking a look at your socials for, the organization, a Symbol of Hope Warriors. And December was quite a busy one for you guys. Hapa na pale kwa kanisa. How often do you, the 400 of you do that? The frequent, visits, do you visit, you're telling us, visiting schools as well, seeing also here, visiting churches. How often does that happen? And what impact do the 400 of you have? Is it only, survivors as well as patients? Do you also have social health workers there? Do you also have medical experts in this group?
Okay, before I forget first, I would love to invite everyone who is around Mama Lucy. We will be having a walk, and also we'll be doing a free cervical cancer screening on 28th of this month, whereby it will be on a Sunday.
On Sunday, yes.
So you don't have an excuse to come.
That's next Sunday.
Next Sunday, but one.
But one, yes.
So just come, and it will be a free cervical cancer screening, and we are the one who has, we have gotten the opportunity from Mama Lucy, so Symbol of Hope with the organizers of the event. So come and do the screening. It will be a free screening, and I'm glad because I would be able, I would love to tell everyone to grab the opportunity, because if you will get screened and either you get a positive or negative result, we are there for you. We'll be able to talk to you and encourage you and guide you as a survivors, and also we will have the doctors on board, the nurses who will be help us. So about your question, we normally meet. We normally talk on a daily basis, and also we have an accommodation whereby it's a free accommodation for the patients who are coming for the treatment around Nairobi, and we have made a big impact. Like in our group, we have a child where we named Hope, whereby the mother was having cancer, and at the period of birth, the mother died, and we decided to adopt the child as the organization. So our biggest aim being to stop stigma. We also have like a friendship whereby we are openly to talk to each other. And when you feel like you need someone to talk to, you need a therapy, we organize a walk together. We go somewhere and just cry or shout out, because surviving cancer is a package itself. The treatment, the cancer journey doesn't end at the treatment. So after the treatment, like Lillian said, you can have the reoccurrence. Yes, I had the reoccurrence, and also sometimes.
I'm sorry to cut you. How is that for you? The reoccurrence.
Getting who needs
the first time you were telling us back in 2015, you fainted.
Yes.
There. So now for the recurrence, how was it?
I felt like there is something that I didn't do well, you see, and I felt like it's not a good feeling, but because I was already running the organization, I got strength, and also I had friends to stand with me who are also going through cervical cancer, and they gave me support, but it wasn't a good feeling at all. Yes.
All right. So, as we continue this particular conversation, before you even get your last words, this when it comes to the detection of it, you'd probably find that years later, a lady might have HPV, but then it might be really detected maybe 10 years later. How does that work? And the impact that can really have even for the health of the lady.
That's why we are encouraging ladies who are 24 and above, if they're sexually active, they go for the screening. Once we listen to your sexual lifestyle, and once we know what is the state of your cervix, that is whether it's negative or positive for cervical cancer, we are able to guide you. What I've said is that if you get the infection today, if you come for the screening maybe in a month or in 2 weeks, we shall not see anything. It's a progressive disease. It is not like the other infections like malaria, where you get bitten by a mosquito and between 14 to 21 days you develop malaria. This is progressive, And the cervix is also a hidden organ, so you cannot vividly see it. So we encourage the preventive promotive aspect of it, where we are supposed to, if you know that you are sexually active, we don't only go to the reproductive health clinic just for family planning. There's also education on your sexual lifestyle. We need to engage to know how your lifestyle is, sexual lifestyle, and guide you appropriately. As health promotion officers, and there are health promotion officer in the 47 counties, we also have the non-communicable disease unit, where also the measure around cancer and other non-communicable diseases. I know cervical cancer is transmittable through sex, but when we look at cancers generally, the rest are non-communicable. We don't know why they occur. So we also, in that unit, talk about cervical cancer. In our reproductive health unit, we talk about it when we are looking at a lady who has come maybe with a baby to the clinic. We know that she's already sexually active. So we also give that conversation of, have you been screened? If it's a lady who has come for family planning, we encourage her to get screened, not only for the family planning services. Right. When we are visiting the workplaces, because the health promotion officers also walk into workplaces, learning institutions, institutions of higher learning, we educate people. Mm-hmm. And why we are taking these conversations down to even the primary level is so that to equip the girls, to equip the boys with information that they are able to now make informed decisions when they grow up. So when we are talking about cervical cancer in the schools, in the learning institutions, in the workplaces, in the churches, we do not talk to ladies. Mm-hmm. We talk to both male and female. Right. For example, in Nairobi County, we have a very good practice. When we are talking to the girls about the HPV vaccine, we talk to the boys about male medical circumcision. Mm-hmm. Because it's all reproductive health. Yeah. So we want to demystify the issue where parents, religious leaders, and other community leaders think we are in that space to talk about sex. Mm-hmm. We are talking about HPV vaccine. We are talking about other issues of health like TB, water, sanitation and hygiene, right. Male medical circumcision. You're seeing that even now, during this period, mm-hmm. where people get their boys to get circumcised, especially in the August and December holidays, oh, yes. we're finding boys who are dying because of mm-hmm. bleeding, mm-hmm. because some even their reproductive organ is severed off because it's cut wrongly. And this needs now the boy again to go for corrective surgery. So we are talking in that space to the girls about menstruation, about HPV, and about male circumcision. So when we are giving that package, we give it both to boys and girls, right. So that the girls can also support their brothers mm-hmm. to get the medical male circumcision, because we tell them this is a conversation to be taken home. Right. We also allow the boys to listen to the issues around menstrual hygiene, okay. So that even you as a grown-up man will take responsibility of knowing that your partner, your daughters are doing it the right way.
Because of time, I'll get your final thoughts. I'll start with you, Millicent. Your final thoughts are?
For me, I would love to talk to the men outside there. Nikiongea kwa Kiswahili, ni vizuri tushikilie wake zetu wakati wanapatikana wako na saratani ya mlango wa uzazi. Ni vizuri tutembee nao, ni vizuri tuwapatie support na tusiwatoroke, kwa sababu ugonjwa iko na lazima tutembee pamoja. And for the survivors, cervical cancer survivors, msichoke. Let us continue creating more awareness so that we can eliminate cervical cancer together for our government. Thank you so much for giving us the free HPV vaccine for our girls so that they wouldn't be able to go through what we are going through like right now. But please kindly remember us as survivors, because some of us, we may not have that education to talk about health, but we are the QBE, qualified by experience, and we can be very helpful for our community so that we can be able to put food on the table, because most of us, we are struggling. Like right now, my daughter is still in the house and she needs to go back to school. But if I had something to work on, if I had a work so that I can be able to bring food on the table, it will be have a good help. And for those girls who are outside there, wale wasichana wenye walifanya mtihani last year, there is no shortcut. Tumeongea about cervix na tumeongea about cervical cancer. Maybe unaweza sema kwa sababu sitaki kupata cervical cancer, wacha nitumie mbinu ingine kujifurahisha. Like okay, wacha niseme ile kitu yenye tunaogopa kusema. Unaweza sema wacha nitumie mbinu ingine kufanya tendo la ngono na ni avoid kupata cervical cancer. Wacha nikwambie, hiyo mahali pengine pia unaweza pata HPV na unaweza patikana na cancer ambayo imeletwa na HPV. So wacha tukue waangalifu na tujiangalie zaidi kwa sababu ya mwili wetu. Na kwa wale ambao wamekuwa diagnosed na cervical cancer, like the other day, I would love to tell you, despite you having diagnosed with cervical cancer, you are still precious, you are beautiful, and you are loved with me here.
Asante.
Thank you.
Asante. Briefly, Mutua.
I just want to say that we really appreciate Ministry of Health for going out of their way to provide the HPV vaccines to girls who are 10 to 14 years. So I encourage all the parents, caregivers, and guardians to ensure that their girls who are between 10 and 14, as per now, and have never gotten the HPV vaccine, to go get the HPV vaccine in the nearest facility that is nearest to them all over Kenya, not only in Nairobi. For Nairobians, if you need the HPV vaccine, you don't know where to get it, kindly call our Emergency Operation and Dispatch Center for Nairobi County, 1508. You'll be able to be led and be told where you can get this vaccine. For ladies who are sexually active, we urge you to go and get your cervical cancer screening. You'll be told whether you need to do it annually, or you need to do it again in another 6 months, or you need to start on treatment. And we really appreciate the Governor of Nairobi for giving us a freeway to continue doing these activities in the communities, in the public facilities, together joined with the churches and with community groups. And also for the leadership of the health sector in Nairobi County, who are tirelessly working to see that all the girls who are 10 to 14 get this vaccine. And also our facilities are readily open to screen the ladies. Kindly drop into the nearest facility, get the free screening. If you need more attention, you'll be referred where to get it.
Asante sana, Lilian Mutua, Head of Health Promotion right in Nairobi County, as well as Millicent Kagonga, cervical cancer survivor, as well as the founder of Symbol of Hope Warriors. Asante sana, ladies, and quite a number of responses from our socials, 22047, as well as TV47 News on X, TV47 KE on Facebook. People enjoying this conversation, saying they've learned a lot. We're taking a short break. We'll be right back to tell you what is happening in your respective counties. Remember, the Form 1s, it is day one for them, joining the secondary education. So we'll be taking a look